Assalamu alaikum everyone, this is Sayyida Bukhari. Welcome back to my channel The Mat Corner, and today in this tutorial we are going to be discussing about the osteology of the tibia bone. So let's begin. So guys, the tibia bone is termed as a shin bone in the Latin, and it is the medial and the larger bone of the leg. So it is marked over here in the green color so you guys can see it. And in your body you guys can easily palpate it by placing your hand on the leg, and you will feel a bone in the leg. This is the anterior border of the shin bone or the tibia. So what you are feeling is the anterior border of the tibia bone. And guys, one frequently asked BCQs about the tibia bone is that which bone is homologous with the tibia bone. So that is the radius bone, which is present in the forearm, marked over here in the green color as you guys can see it. So this bone, the radius bone, is homologous with the tibia bone of the leg. These both bones are present at the medial side, so that radius is present medially in the forearm while the tibia is present medially on the leg. Another frequently asked question about the tibia is that which of the following is the weight bearing bone of the leg. So you have to choose tibia. Tibia is the weight bearing bone of the leg, and at the lower end you guys can see that it has a medial malleolus which is forming the ankle joint, and the fibular bone is having the lateral malleolus which is present laterally. Now let's just isolate the tibia bone so we can learn about the osteology of the tibia bone, the upper end, the lower end, and the shaft. So guys, here we have isolated the tibia bone, and you guys can see that this yellow marked area is the proximal end or the upper end of the tibia bone, and this purple marked area at the lower end is the lower end or the distal end of the tibia bone, and this green marked area is the shaft of the tibia bone. Now let's just discuss about the features of the upper end. So guys, in the upper end of the tibia bone you will find the prominently two condyles, the medial condyle and the lateral condyle. So this area marked over here in the red color is a medial condyle of the tibia that articulate with the medial condyle of the femur to form the knee joint, and the lateral condyle, this is the lateral condyle of the tibia, and this condyle articulate with the lateral condyle of the femur to form the knee joint. So these two condyles, the medial and the lateral condyle, are forming the knee joint by articulating with the medial and the lateral condyle of the femur bone. Now guys, in order to differentiate between which one is the medial condyle and which one is the lateral condyle, so you will see that the medial condyle is larger than the lateral condyle. This is the first difference between these two, and on the second difference you will see that the lateral condyle, the anterior aspect of the lateral condyle, bears a Gerdy's tubercle over here. So this is the Gerdy's tubercle which provide the insertion of the iliotibial tract, which is again a frequently asked question. And on the posterior lateral side of this lateral condyle you will find out the fibular articular facet over here. By remembering this, that the condyle having the facet posteriorly and a tubercle anteriorly is the lateral condyle of the tibia bone. Furtherly, if we take a look from over here, you guys can see that this is the anterior intercondylar area, and this is the posterior intercondylar area at the upper end of the tibia that is present between the medial and the lateral condyle. And further you will find some tubercle at this intercondylar area. So this is the medial intercondylar tubercle which is present on the medial condyle, and this is the lateral intercondylar tubercle which is present over here. And the last thing that you will find on the upper end is this tibial tuberosity or the tibial tubercle, which is very prominent and located on the anterior aspect of the upper end of the tibia, which provide a surface for the insertion of the patellar ligament. Now moving toward the shaft of the tibia bone. So the shaft of the tibia bone is very simple. It has the three border, the anterior border, the medial border, and the interosseous border, and it has the three surfaces, the lateral, medial, and the posterior surface. So let's just discuss about them. So guys, this is the anterior border of the tibia bone, and it is also forming the shin, and it is the most prominent border, and you guys can palpate it on your leg as well. So on your leg you will feel a prominence, that is the anterior border of the tibia bone. Now this is the medial border of the tibia bone, and it extends from the medial condyle and go posteriorly to the medial malleolus at the lower end. Now the third one is the lateral border, which is also termed as the interosseous border, that extend from the lateral condyle of the tibia bone all the way to the fibular notch that is present laterally at the lower end. Now let's just talk about the surfaces of the tibia bone. So this is the lateral surface that lies between the anterior and the interosseous border. This is the medial surface that lies between the anterior and the medial border. Now let's just talk about the lower end of the tibia bone. So the lower end of the tibia is slightly expanded, and if you will see that medially it is prolonged downward and has the medial malleolus over here. Further, you will see that the anterior surface is larger than the posterior surface, and on the inferior surface over here, you will see that this is the inferior articular facet, and it articulates with the talus to form the ankle joint. And on the lateral surface, you will see the triangular facet that is termed as a fibular notch, where the fibula head articulate inferiorly to form the inferior tibiofibular joint. So guys, this is all about the osteology of the tibia bone. I hope you guys understand it, and if you do so, then make sure to like and subscribe to the Mat Corner. See you all. Take care.